Today, we're talking about something that caught the attention of many families in our community, a confirmed case of mumps connected to one of our local elementary schools. To help us understand what this means, how public health responds, and what families should know, I'm joined by Andrew Hoffman, administrator of our local health department. Andrew, thanks for taking the time to talk with us.
Of course, Jody. Thank you for the invite.
Andrew, before we get into the details, can you briefly explain your role at the health department and what your team is responsible for when it comes to protecting public health in our community?
Okay. At the Andrew County Health Department, at our local health department level, our focus is prevention. That prevention focus comes in many different realms, including giving vaccinations, education, even inspections is another way to prevent. And of course, following up with communicable disease investigations.
For those who may have only heard bits and pieces, what can you share about the situation involving the mumps case connected to the elementary school?
Right. We have a confirmed case of mumps in Andrew County, and it is related to an upper elementary school age student in John Glenn Elementary School. All of the potential contacts have been reached. We've reached out to all of them. Um, as an abundance of caution, we wanted to make sure they had awareness that there was a potential close contact and what signs and symptoms to watch out for, and if they see those, what to do.
Well, we want to take just a quick break and thank our sponsors just very quickly before our next question. Of course, we have Edward Jones, Greater Than Financial, Pancakes, Pups and Suds, Genus Cafe, NCMC, and Scooters. So, Andrew, what does the health department typically do first when a communicable disease like mumps is identified in a school setting?
Well, and it really doesn't matter whether it's a school or not in the school. The first thing we do is we contact the case or the case's parents. And of course, that's the initial stage to run through some contact tracing and try to determine if there's more contacts out there, if there's a related contact that this person may have received it from. But that's the initial stage is to get as much information about the onset, the symptoms that were experienced, and so forth. The second step, of course, if the school's involved, is to contact the school district.
So, for people who may not be familiar with it, what exactly is mumps?
Mumps is a virus. It's a respiratory virus and occurs worldwide. Humans are the only known natural host. It's spread by droplets of saliva or mucus, either when people cough, sneeze, or talk. Um, and and that's very similar to most other respiratory viruses. It's very similar.
And what are the most common symptoms that parents should be aware of?
The symptoms can vary, of course. You're going to have, they're going to start feeling sick. They're going to start having a little bit of a headache, a loss of appetite, a low grade fever, those types of things. Does that sound familiar? It sounds like a lot of other diseases and viruses that are going around right now. The main thing to watch out for is going to be, they call it peritosis. It's the swelling of the salivary glands, and those are going to be located underneath the ears on the neck. And once those start to swell, at that point is what we're recommending parents or community members should contact their physician. If they're attend a school, then of course they should contact the school for awareness. Say, hey, I had some symptoms that may be related. We've gone to the doctor and we're awaiting tests. That way, there's a heads up to the school district, and of course, I'm sure the school district would reach right out to us so we can start preparing if it is a positive case.
And for John Glenn parents, how long does it take for a symptom to kind of get into a person's system after being exposed? The reason why I ask is thankfully we're on spring break this week. I'm sure that that's
Right.
helpful and that's something that you think is a total blessing, right?
Yes, yes. It can be up to 25 days afterwards. And so they do need to monitor for quite some time.
And when you talk about how the symptoms are so closely related, it sounds like, yeah, sinus infection or strep or the flu, but having that swollen gland and then all those other symptoms, should parents, especially with a fever, should parents just make an appointment, especially if they're in the John Glenn Elementary School with their doctor?
should at least communicate with their doctor. If they notice any of those symptoms, they could at least communicate with their doctor, let them know that there has been a positive case in the same grade, um, and that they want to just confer with their doctor to see if their doctor wants them to come in for any kind of testing.
And at
Um,
this point, you haven't had any additional cases that have been
no,
reported.
not up to now. Correct.
And then typically, we were talking about droplets and that's how it's
Mm.
spread. But we know with elementary kids, maybe not enough hand washing, maybe, kind of wiping their nose without a tissue. So that is typically how it is spread.
Yes, it can spread by surfaces also, and of course, contact, sharing drinks, sharing food. If that virus is on your hands and you touch your eyes, nose, or your mouth, you can introduce that virus into your body. So, of course, proper disinfection of surfaces, proper hand washing, and always the thoughtfulness of or the mindfulness of not touching your eyes, nose, and mouth unless you know you've recently or just washed your hands properly. Washing your hands, getting the virus off your hands if you have to touch your eyes, nose, or mouth.
Well, one question that many parents probably have is how contagious is mumps, particularly in a school environment?
Of course, that's a very good question. Um, Mumps is not as contagious as measles, and it's not as contagious as chickenpox. But it is contagious. Typically, we're going to look at a close contact as being 3 feet or less face to face. And so that's going to be a direct face to face contact. If they're 6, 7 feet away, that's not typically going to be considered a close contact. We made a lot of phone calls for potential contacts that it was over abundance of caution. Some of those very likely weren't even near the case, and so but we wanted to make sure there's a lot of awareness out there and to monitor for those types of symptoms.
Well, I hate to wrap the measles question up in this, but I have to ask. Um, you and I went through COVID together. I was talking to you every
Yes.
couple days. And so, in that, is this reminiscent a little bit of that where you're worried about vaccination? And what role does vaccination play in preventing outbreaks?
Is extremely important. It really is. We know that, and I'm going to read this if you don't mind, so that I have accuracy to it. We know that all vaccines and medications are not 100% effective. They're just not. The first dose of MMR is in that's measles, mumps, and rubella. So that's a three virus protection dose. It's 97% effective against rubella, 93% effective against measles, and this is the first dose, and 78% effective against mumps. Okay, now something important our community needs to be aware of is measles are on the rise nationwide. um, I believe there's been a case reported in the Kansas City area. Measles has more severe symptoms and it spreads quite rapidly. And so, if you're concerned about measles, I'd recommend people get their vaccinations. After the second dose, um, people are going to be 97% effective for measles, 88% effective against mumps. So that's still very, very effective. And if a person who is vaccinated, fully vaccinated even, can get the virus. Again, it's not 100%. However, those symptoms they have are going to be a lot less severe.
And when should a parent contact the health department?
If they have taken their child to um, a healthcare provider, their healthcare provider thinks it's important enough to have a test done. It'd be very nice to have the heads up because sometimes the testing can take a while. If we're prepared that, hey, somebody had the symptoms enough that where a physician thought they should go ahead and get tested, that gives us kind of a head start on it, kind of to get intervening into the process.
And when something like this happens locally, what steps does the school district take to prevent further spread?
Okay. The school districts they're very strong partners of us within the community. We work with them hand in hand, especially with things like this. Of course, our prevention focus, we work with them on a lot of different educational aspects. On something like this, we work with them directly, speak to them about, okay, we kind of contact trace with them within the schools. They can do that on their own. We can partner with them and assist them with that process. It's hard for us to know, as a health department, who sat next to who in what class, and did that class intermingle with other classes, or do they intermingle at lunch or at recess? But the school district, they're aware of those types of situations, and they can help us narrow it down to where it's not a everybody needs to be aware, which they still do, but it lessens those concerns of those parents in the other classes that most likely had no close contact.
Well, and that brings up a good next question, which is for the teachers and the staff at the school. How likely is it that a case of the mumps or even the measles spreads to adults?
It can happen. Of course, you still have if you've been vaccinated, you still have immunity, but you can still get it. Measles, mumps is more. Um, the symptoms are more severe in adults than they are in children. So I definitely recommend that any teachers that thought we've made contact with some of the staff at the school, but any of the others that think they may have had a close contact, we of course recommend for them to check their vaccination records.
My goodness. So, what kind of more severe symptoms should adults look out for?
For adults, all of the symptoms I mentioned can be more severe, but it also includes things like testicular inflammation, inflammation of ovaries, and there can be consequences for women who are pregnant. So, of course, it's something to be mindful of. And if you're not vaccinated and would like to get vaccinated, of course, reach out to your healthcare provider, reach out to the Andrew County Health Department or your local health department, wherever you may be, and obtain that protection if that's what you'd like to do.
A lot of us have insurance, some don't. If we were to go to the health department and our children are not vaccinated, do you guys offer free vaccination or is that something we need to pay for?
Okay. For people who have a health insurance, we do bill your insurance. However, preventative vaccines are typically covered 100% by most insurance carriers. So there would end up being no cost to you as the client. If you do not have insurance, um, call us. We have vaccine that's provided by the state that we can utilize on people who are underinsured, it's not covered, or have no insurance.
That's really good to know. That's really good to know for our families because we know that the rate of free and reduced school lunches
Hmm.
is high in our
Right.
district. So that's really good to know. Well, situations like this obviously can create a lot of questions in a community. What would you want parents and families to understand right now this week?
I want the parents to understand that this disease is typically mild for youth. And of course, that's not across the board, but it's typically not severe for youth. They should have awareness that a confirmed case of mumps has occurred within our community. They should have awareness to monitor for those symptoms that we talked about. It's very important to catch it as soon as you can to prevent the spread going further. And of course, with any virus, proper hand washing and remembering not to touch your face unless you know your hands have been recently cleaned. All of those taken in together can help prevent the spread from going any further.
Andrew, before we wrap up today, is there anything else that you think families should know, really specifically about the health department? I know that you guys do a lot in our community, and some of us are really uneducated on what you do.
I would love for everybody in our community to visit our website, visit our Facebook page. Our website is easy. It's andrewcountyhealth.com, and you can get to our Facebook from there. We try to put out the best information we can have. We There's a lot of information in there. There's a lot of links. There's a lot of community links. That's our goal is for prevention. And so having mental health resources on our website is extremely important to us, where if somebody's feeling down or needs somebody to talk to, they can real quick go to our website and find some links or some phone numbers of somebody to call. We have a lot of information. And so I welcome anybody to go online and learn a little bit about your local health department and stop by and visit if you'd like to.
Well, I love that. You and I have talked about the concern for mental health in our community. And so I
Hmm.
love that you have that resource. And Andrew, you have like been so great to work with me over the years. I've really appreciated it. So thanks for jumping on today.
You're very
Um,
welcome.
Andrew Hoffman with our local health department, thank you for taking the time to help us better understand what's going on and how our community can stay healthy. Gosh, that was such a good update for us. Stay tuned to our 3994 Facebook and Instagram pages. We'll have a docket of spring events coming up. There's lots happening right here locally. Until next time.